Having a joint replacement is a fairly big decision, so it's probably a good idea to try and plan ahead. So in today's video, I'm going to go through exactly what you can expect after having a joint replacement so that you can get better quicker. And we're going to start right now. Before we get into what to expect after the surgery, if you are watching this video and you have not had a joint replacement yet, then the most important thing that you can try and do at this stage is to get your joint in the healthiest possible condition that you can. So trying to incorporate some movement and strength exercises into your weekly routine for a few weeks before the surgery is likely to pay dividends afterwards. Now, a joint replacement is always last resort. And the reason for that is because it is a very invasive surgery. It involves surgically removing the old arthritic joint and replacing it with a new one. Now, this is not done easily, and it is done with quite a degree of force, which goes some way in explaining some of the symptoms or factors that you may experience afterwards. For most average knee and hip replacements, the length of stay in hospital is likely to be between 2 and 5 days, depending on whether you have any underlying health conditions or whether there are any complications with the surgery. Your surgeon will make sure that you have full range of movement available in your joint after they finish the surgery whilst you're still on the operating table. And for most people, you will be fully weight bearing as your pain allows from day one. Depending on what time of day you have the surgery, you should be visited by a therapist either on the same day or the following day. And they will provide you with some walking aids in the form of a couple of elbow crutches or, if necessary, a frame, and also a rehabilitation program designed to try and get your joint moving as soon as possible. You'll probably be discharged with these walking aids and the all-important pain medication. That brings us nicely onto the first thing to expect if you have a joint replacement. And I'll be honest with you, it is pain. Now, you may be expecting some pain afterwards, but in some cases it is very painful. And I have seen many patients that are surprised by how painful it is. Now, we mentioned that it is a very invasive surgery. There is a lot of trauma that happens to the soft tissues in that joint. The muscles, tendons, ligaments and bones undergo a lot of trauma. And as a result, you will end up with swelling, inflammation and pain. Now, hopefully this will only be for a short period of time, but the most important thing to do after a joint replacement is to get started with your rehabilitation. And the only way that you can do this is if your pain is well controlled. So make sure that you have adequate pain relief from the very beginning. Like I said, you probably will be discharged with some pain relief, but this will run out at some stage. So make sure that you have put plans in place with your doctor after the surgery so that you can get adequate pain relief. There are a few other things that you need to monitor post-surgery. Now, for most of you, there is likely to be a fairly significant wound, and this will have a dressing over it for a short period of time. But make sure you are aware of signs of infection. So things like generally feeling unwell in yourself, excessive redness, heat around the area, if the wound is oozing, or if it's producing any funky smells. The other thing that you need to be aware of is a DVT. That stands for deep vein thrombosis, and you may have been put on blood thinners to try and reduce the risk of this happening post-surgery. What happens is a blood clot develops in your leg, and if it becomes dislodged, it can move around the body and it can cause a stroke or pulmonary embolism. Now, it is exceptionally rare, so don't worry, but it is important you know what the signs and symptoms are. I'm interrupting just for a second to say if you would like to know more about osteoarthritis and all other things pain and rehabilitation, hit that subscribe button so you get notified every time I release a new video, which I do every single week. Thank you very much for watching and enjoy the rest of this one. It is normally characterized by calf pain and swelling. So we're looking for swelling that is 3 centimeters larger than the unaffected side. It's normally painful without touching it, but it is also normally painful to touch. You may notice veins developing in the calf that may not have been there before, and the skin can look red, hot and shiny in texture and colour. There is a specific scale that we use as clinicians to try and rule in or out a DVT, and I've popped a link to that in the description below the video. Your affected joint will be swollen post-surgery. Now, knees tend to be more swollen than hips because hips are more mobile and the swelling has a larger area to dissipate into. Swelling is affected by gravity, so you may find that if you have a knee replacement or a hip replacement, you may develop swelling further down the leg as well. In addition to swelling, you may also notice the joint is quite red and hot, and you may also notice a significant amount of bruising. Now, these things are all very normal in the first few weeks after a joint replacement, but they do need to be managed well. That's where the pain medication comes in, but also try and make sure you do all of the normal swelling management techniques, so your elevation and your ice and your regular movement as your pain allows. You are likely to have reduced range of movement post-surgery. I know I said earlier that the surgeon will make sure that you have as close to full range of movement as possible whilst you're still on the table. But because of the invasiveness of the surgery, there are a lot of secondary compensations that occur afterwards. Things like joint swelling, inflammation, stiffness, and muscle weakness and tightness are all likely to reduce your movement. And these will be key factors that you focus on with your therapist once you're doing your rehabilitation program. And a quick note of caution whilst we're talking about movement: if you are having a hip replacement, depending on your surgeon, there may be certain precautions placed on movements in certain planes. And this is designed to protect the replacement. So do make sure you double check with your consultant as to whether you have any precautions with movement if you're having a hip replacement. Now, as soon as your wound has healed, you can be quite aggressive with these range of movement exercises, particularly with knee replacements, as the movement can be quite stubborn in coming back. So it's normal for them to feel tight, uncomfortable, and probably painful from time to time. But be aware that your joint is very stable and it can tolerate quite a lot of force. You'll be pleased to know that I have put some videos together on how to get your movement back if you've had a knee replacement or a hip replacement, and you can find links to those videos here and in the description below. The last thing to expect after a joint replacement is numbness. Now, this is often something that people don't expect after a joint replacement. Now, essentially the surgeon has had to make an incision through your skin, and your skin contains sensory nerves. Now, these nerves can become affected or damaged after you've had the surgery, and as a result, you may find that you have reduced sensation in that area. Now, there's no real way of knowing whether it is going to come back or not. It's just a case of waiting and seeing. I hope you found that useful. I have put some additional information in the description below the video to help you manage your osteoarthritis or your joint replacement better at home. And I'd love to hear from you. So drop me a comment and let me know which thing you found most useful from today's video. If you are new to the channel, then hit that subscribe button so you get notified every time I release a new video, which I do every single week. And if you're feeling really generous, hit the like button as well whilst you're there. If you did enjoy today's video, you may also like the video I have put together on how to rehabilitate your knee replacement, or you might like the one I have put together on how to rehabilitate your hip replacement. Thank you very much for watching, and until next time, I'll see you again very soon.